Did you know that mosquitoes kill more people than any other animal on Earth? In this video, we're breaking down 3 dangerous mosquito-borne viruses you may have heard of, or maybe not. 1. West Nile virus. 2. Chikungunya virus. 3. Oropouche virus. We'll explain their origins, how they spread, the diseases they cause, prevention tips, and whether there are vaccines or cures. Let's dive in. West Nile virus was first discovered in Uganda in 1937, near the West Nile district. But it really hit the headlines when it reached North America in 1999.
Tonight, more American families in agony.
It's hard to see them like this.
In St. Louis, John Proctor's once healthy 18-year-old son lies paralyzed on a ventilator at Barnes Jewish Hospital after John says BB got West Nile virus from a mosquito bite earlier this month.
West Nile virus spreads when mosquitoes bite infected birds and then pass the virus on to humans. You can't catch it from another person, only from an infected mosquito. Most people don't show symptoms, but about 1 in 5 get flu-like symptoms: fever, headache, joint pain, vomiting, or rash. In rare cases, the virus attacks the brain or spinal cord, causing meningitis or encephalitis. These cases can be deadly. There's no vaccine or specific treatment, so prevention is key. Use insect repellent. Wear long sleeves outdoors. Eliminate standing water where mosquitoes breed. If symptoms are severe, seek medical care right away. Next up is a virus with a name that's hard to say but easy to catch if you're not careful: chikungunya. Chikungunya was first identified in Tanzania in 1952. It spreads through Aedes mosquitoes, the same mosquitoes that spread dengue and Zika. These are aggressive day-biters found in Africa, Asia, and the Americas. Chikungunya virus hits fast. Symptoms show up 3 to 7 days after a bite and include high fever, headache, rash, debilitating joint pain that can last weeks or months. Though rarely fatal, it can severely affect quality of life. While there is no specific antiviral treatment, symptoms like fever and joint pain are managed with rest, hydration, and medications, such as acetaminophen or nonsteroidal anti-inflammatory drugs, NSAIDs, though NSAIDs should be avoided until dengue is ruled out due to bleeding risks. Recently, vaccines like Ixchiq and Chikungunya have been approved to help prevent chikungunya, particularly for travelers to high-risk areas. So again, prevention is your best defense. Mosquito nets, repellent with DEET, draining water containers around your home. Last but not least, we've got one you might not have heard of: Oropouche virus or slough fever. But it's making waves in parts of South America. Oropouche virus was first found in Trinidad and Tobago in 1955, named after the Oropouche River. It's mainly spread in Brazil, Peru, and other Amazon basin countries. Unlike the 2 aforementioned viruses, Oropouche virus is spread by biting midges, tiny flies, and sometimes mosquitoes. It also circulates between sloths, monkeys, and birds in jungle areas. Oropouche virus typically presents with flu-like symptoms such as high fever, severe headache, chills, muscle and joint pain, nausea, vomiting, and a skin rash. Some patients may also experience dizziness, sensitivity to light, or eye pain. While most cases resolve within a week, symptoms can recur days or even weeks later, and in rare instances, the virus may lead to serious complications like meningitis or encephalitis. There is no specific treatment or vaccine, so care focuses on symptom relief and prevention through insect bite protection. The ways to protect yourself are: avoid insect bites, stay indoors during peak biting times, use screens, nets, and repellent. So here's the big picture. West Nile, chikungunya, and Oropouche viruses are all spread by insects. There are no cures or approved vaccines. Yet, the best protection is not getting bitten. If you travel to areas where these viruses are active, be prepared. And if you feel sick after a trip, see a doctor ASAP. Have you heard of any of these viruses before? Tell us in the comments. And don't forget to like, share, and subscribe for more health and science content that matters. Stay safe, stay curious, and keep learning.